Learning objectives. At the end of the video, the student should be able to describe the boundaries of popliteal fossa. The student should be able to describe the contents of the popliteal fossa, and the student should know the clinical correlates regarding the popliteal fossa. Bismillahirrahmanirrahim. Popliteal fossa, you have to focus on the images, ठीक है? It's very simple topic. Popliteal fossa is a diamond-shaped space which is present behind the knee joint. तो कुछ cubital fossa याद आ रहा है मेरे बच्चों? You remember cubital fossa we have done in the upper limb. It was anterior to the elbow joint. Similarly, the popliteal fossa is a diamond-shaped space present behind the knee joint. This popliteal fossa is formed between the muscles in the posterior compartment of the thigh and the leg. It is formed between the muscles of the thigh and the leg. The popliteal fossa is actually an important area of transition between the thigh and the leg. It is the major route by which the structures pass from one region to other region. You can see in the figure, this is the diamond-shaped popliteal fossa, which is present behind the knee joint, and it is a transition point through which the neurovasculature and leaves the thigh and enters into the leg region. Boundaries of the popliteal fossa. Now you have to remember the name of the muscles which are forming these boundaries. So when you looked into the figure, the superolateral boundary is formed by biceps femoris. This is biceps femoris muscle. So the superolateral boundary, the superolateral boundary is formed by the biceps femoris muscle. The supromedial boundary is formed by the semimembranosus and the semitendinosus muscle. S यहाँ से miss हो गया है. This is semitendinosus muscle, and this one is semimembranosus muscle. So you can see these two muscles are forming the supromedial boundary. ठीक है ना? तो diamond shaped है. It means it has 4 walls, 2 superior walls, superolateral formed by biceps femoris, superomedial, medial formed by semimembranosus and semitendinosus muscle. The inferior boundaries, the inferolateral boundary is formed by the lateral head of the gastrocnemius muscle. Now you know this is gastrocnemius muscle. अच्छा, अगर आप लोगों ने अभी तक posterior compartment of thigh नहीं किया है तो don't worry, its class will be uploaded very soon. Then you can follow the popliteal fossa. So the inferior boundary, the inferolateral wall is formed by the lateral head of the gastrocnemius muscle. This is the gastrocnemius muscle. Along with it, there is a small muscle which is also forming the boundary. This is plantaris muscle. ये देखिए गौर से. This muscle is plantaris muscle. So, two muscles are present in the inferolateral boundary, gastrocnemius muscle and the plantaris muscle. The inferomedial is formed by the medial head of the gastrocnemius muscle. So what are the boundaries? If I ask you a question, what are the boundaries of the popliteal fossa? The first thing you will say, it is a diamond shaped cavity or space or fossa which is present behind the knee joint. It is bounded by the muscles of the posterior compartment of the thigh and the leg region. It has four boundaries: superior boundaries, superolateral and superomedial. The superolateral boundary is formed by the biceps femoris muscle. You can see over here, biceps femoris muscle, superolateral boundary. The superomedial boundary is formed by the semimembranosus and the semitendinosus muscle. The inferior boundaries on the lateral side, they are formed by lateral head of gastrocnemius as well as by the plantaris. The medial inferomedial boundary of the popliteal fossa is formed by the medial head of the gastrocnemius muscle. Gastrocnemius muscle actually has two heads, a medial head and a lateral head. I am sure कि सबको ये boundaries अपने दिमाग में, अपने brain में fix कर ली. You have to memorize, remember, learn these name of the muscles which are forming the boundaries of popliteal fossa. The roof of the popliteal fossa is formed by the skin and by the deep fascia. आपको पता है that the outermost covering of the lower limb is skin, then you have a superficial fascia and you have a deep fascia. Deep fascia is more prominent in the lower limb. The floor is formed by the bones. Superiorly there is femur. It is behind the knee joint, so there is capsule of knee joint, as well as there is a muscle which is called as popliteus muscle. So popliteus muscle is also present in the floor of the popliteal fossa. The deep fascia of the popliteal fossa is important as it has certain important contents. Now in the deep fascia of the popliteal fossa, there is the small saphenous vein. ठीक है, हम देखते हैं यहाँ पर small saphenous vein. This is the small saphenous vein, and you can see that it is piercing the deep fascia and entering into the popliteal fossa. The small saphenous vein ascends from the lateral side of the dorsal venous arch in the foot. It penetrates the deep fascia to join or to open into the popliteal vein. आपको पता है there are two saphenous veins. There is a great saphenous vein which runs on the medial side, and there is a small saphenous vein. The small saphenous vein ascends upward from the lateral side of the dorsal venous arch in the foot. It ascends upward on the posterior compartment of the leg, and it pierces the deep fascia in the region of the popliteal fossa and drains its blood into the popliteal vein. The second important content which is present over here is the posterior cutaneous nerve of the thigh. So this is the posterior cutaneous nerve of the thigh which is present in the deep fascia of the popliteal fossa. Third important content is the medial and the lateral sural cutaneous nerves. These are the sural cutaneous nerves. The medial and the lateral sural cutaneous nerves are also present in the deep fascia covering the popliteal fossa. So what you have to remember is that the roof of the popliteal fossa is formed by the skin and by the fascia. The fascia has three important structures. First is small saphenous vein. Second is posterior cutaneous nerve of the thigh. And third, medial and lateral sural cutaneous nerves. ठीक है? चलें. Before we move to the contents, we will just revise the boundaries. We said that popliteal fossa is a diamond-shaped fossa present behind the knee joint. Okay? It has a roof which is formed by the skin, by the fascia. Fascia having three important contents: saphenous vein, small saphenous vein, the sural nerves, and the posterior cutaneous nerve of the thigh. Its floor is formed by the bones, the femur bone, the knee joint is present over here, so the capsule of knee joint, as well as by a muscle which is called as popliteal muscle. Popliteal fossa है तो कौन सा muscle होगा floor में? Popliteus muscle. It has a superolateral boundary which is formed by the biceps femoris. This is biceps femoris. It has a superomedial boundary which is formed by the semimembranosus and the semitendinosus muscle. The inferolateral boundary is formed by the lateral head of the Gastrocnemius along with the plantaris. This is the plantaris. And the inferomedial boundary is formed by the medial head of the gastrocnemius muscle. Now, what structures are present inside the popliteal fossa or the contents? They are the popliteal artery, popliteal vein, termination of the small saphenous vein, which we told you. ठीक है? तो ये तीन चीजें पहले हम फिगर में देख लेते हैं. Popliteal artery, this is the popliteal artery. ठीक है? Then you have the popliteal vein, this is the popliteal vein. Then you have over here termination of the small saphenous vein. This is the opening of the small saphenous vein into the popliteal vein. The small saphenous vein opens into the popliteal vein and drains its blood into the popliteal vein. Okay. और क्या है यहाँ पे भाई, और क्या कंटेंट है देखते हैं. Then you have the tibial nerve and the common fibular nerve. So this is the tibial nerve. This is the tibial nerve. Okay. The common fibular nerve. This is the common fibular nerve. Then you have posterior cutaneous nerve of thigh. Posterior cutaneous nerve of thigh, which is not seen in this figure, but it was seen in the deep fascia. Remember, I told you that in the deep fascia there is posterior cutaneous nerve of the thigh and there are the popliteal lymph nodes. So these are the contents. क्या contents हो गए? Popliteal artery, आपको femoral, आपको cubital fossa याद होगा, उसमें भी artery. Actually basically neurovasculature is present. तो neurovasculature का क्या मतलब है? Artery, vein and nerve. The popliteal artery, popliteal vein, nerve कौन सी होगी? Sciatic nerve की दो branches, tibial nerve and the common fibular nerve. Then you have the deep fascia contents, which are the small saphenous vein, the posterior cutaneous nerve of the thigh. The first content is the popliteal artery. Now you remember the femoral artery? तो ये femoral artery की continuation ही है. What happens? The femoral artery enters into the adductor hiatus and it changes its name to the popliteal artery. Femoral artery जब adductor canal adductor hiatus के अंदर enter होती है, now its name changes to popliteal artery. So popliteal artery is actually a continuation of the femoral artery at the level of adductor hiatus. The popliteal artery arises from the adductor hiatus as a continuation of the femoral artery. It runs up to the lower border of the popliteus muscle, and here it divides into the anterior and the posterior tibial arteries. So what happens? This is the popliteal artery. It leaves the adductor hiatus. It runs in the popliteal fossa, and when it reaches the lower border of the popliteus muscle, you can see it is dividing into anterior tibial artery and the posterior tibial artery. So it has divided into anterior tibial artery and the posterior tibial artery. It gives off branches in the popliteal fossa. It gives off articular branches which form the genicular anastomosis at the knee joint. It gives off muscular branches which supply the muscles, and popliteal artery is the deepest structure and the most medial structure present in the popliteal fossa. So you can see it is the deepest and the most medial structure present in the popliteal fossa. The second content is the popliteal vein. Popliteal vein is formed at the distal end of the popliteal fossa by the continuation of the posterior tibial vein. Okay? How the popliteal vein is formed? It is formed by the continuation of the posterior tibial vein. Now its course is important. You can see it crosses behind the artery from medial to lateral. You see over here, the popliteal vein is first present on the medial side. It then crosses the artery and comes to lie on the lateral side. The popliteal vein runs upward and it forms the femoral vein at the level of the adductor hiatus. तो अब क्या स्टोरी है? वेन्स कहाँ से स्टार्ट होती है? वेन्स नीचे से स्टार्ट होती है, राइट? So how the popliteal vein is formed? पहली बात तो ये, it is formed by the continuation of posterior tibial vein. It is formed by the continuation of posterior tibial vein. It runs in the popliteal fossa. It crosses the popliteal artery from medial to lateral. From medial to lateral. It then runs upward and it continues as the femoral vein and enters into the adductor canal. The tributaries of popliteal vein are the corresponding veins to the branches of popliteal artery, as well as one important tributary is the small saphenous vein, which we told you pierces the deep fascia and enters or drains into the popliteal vein. The nerves of the popliteal fossa. Now this is the sciatic nerve, the main nerve of the posterior compartment of the thigh. The sciatic nerve splits at the superior angle of the popliteal fossa to form the tibial nerve and the common peroneal or the fibular nerve. You see, this is sciatic nerve. It is dividing at the apex of the popliteal fossa into tibial nerve and the common fibular nerve. This is the tibial nerve, this is the common fibular nerve. These are the most superficial structures present in the popliteal fossa. तो सबसे deepest structure कौन सा था? Remember, it was the popliteal artery. Popliteal artery is the deepest structure and is the most medial structure. सबसे medial है. Then you have the popliteal vein. Then you have the tibial nerve. Artery, vein, tibial nerve. This is the sequence from medial side. So the first division is the tibial nerve. The tibial nerve is the medial and the larger and the more superficial branch of the sciatic nerve present in the popliteal fossa. So we said that sciatic nerve divides into tibial and common fibular nerve. The tibial nerve is the most medial. Most medial का मतलब है कि artery vein के करीब है. Comparison to the fibular nerve, it is the medial, it is the larger and more superficial branch of the sciatic nerve. The tibial nerve you can see runs in the popliteal fossa. It leaves the fossa and it passes to the posterior compartment of the leg. Over here it gives a branch which is called as medial sural cutaneous nerve. It gives a branch which is called as medial sural cutaneous nerve. The second nerve which was given by the sciatic nerve, which was a branch of sciatic nerve, is the common fibular nerve. The common fibular nerve is the lateral and the smaller branch of the sciatic nerve. It follows the tendon of biceps femoris and it swings around the neck of the fibula and enters the lateral compartment of the leg. And you can see in this figure that the sciatic nerve winds or swings around the neck of the fibula and it enters into the lateral compartment of the leg. Clinical importance. So we have completed our contents. Our contents were the popliteal artery, popliteal vein, the two branches of sciatic nerve, the tibial nerve, the common fibular nerve. Now lymph nodes, popliteal lymph nodes are also present over here and they are draining the lateral part of the foot and the lateral part of the leg. Baker's cyst. Now sometimes there is inflammation of the synovial sac of the knee joint. Inflammation of the synovial sac of the knee joint. Okay? And it produces a posterior bulge into the popliteal fossa. See over here, it produces a posterior bulge in the popliteal fossa. When it becomes large enough, it becomes palpable. This cyst may communicate with the cavity of the knee joint or may be separate. It is actually the inflammation of the synovial sac of the knee joint. It is called as Baker's cyst. The Baker's cyst causes significant discomfort and impairs the function. The rupture of the Baker's cyst is associated with acute pain and with calf swelling. These are the calf muscles and it can lead to swelling and pain in the calf muscles. So we have to drain the fluid, drain it through the surgical procedure. Popliteal aneurysm. Now you know that there is a popliteal artery in the popliteal fossa. It can become dilated and the condition is called as popliteal aneurysm. The popliteal aneurysm is related to chronic flexion and extension cycle. Due to repeated flexion and extension, the popliteal artery wall can become delicate and it can become dilated. The presentation will be a pulsatile mass in the popliteal fossa. Pulsatile because artery pulsates, so a pulsatile mass present in the popliteal fossa will be an aneurysm. It produces symptoms related to the nerves traversing the fossa. If it becomes large enough, it is going to compress the nerves which are present in the popliteal fossa, and the relevant symptoms can be produced. The risk factors are the aneurysm can have a thrombus development that can be leading to distal embolization, or there can be acute thrombosis, or there can be a rupture of the aneurysm. Now, this aneurysm can be associated with another aneurysms present in the leg region, present in the femoral artery, or present in the aortic artery, aorta. The treatment is bypass and stenting. This is all about the popliteal fossa. Thank you so much, dear students. If you have any question, you can message me on the Google Classroom.